Hi everyone, my name is Rana Andari and I'm the Alcohol and Other Drugs Programs Coordinator with the Center for Student Wellness and Health Promotion. Today I'm going to be talking to you about alcohol and other drug use at UCI, how you can stay safe, and how you can keep your friends safe too. So let's get started by talking about alcohol use at UCI. As many of you may have heard, UCI isn't exactly known to be a party school, and our data does reflect that. 40% of students at UCI choose not to drink for various reasons. 50% of UCI students choose to drink in a low-risk way, which means they know their limits, drink in safe environments, and look out for their friends. And that leaves 10% of UCI students who choose to drink in a high-risk way. This means that they may drink until they black out, drink excessively throughout the week, or allow their alcohol use to negatively affect their social and academic lives. So in order to quantify low-risk drinking, we'd like to teach you what one standard drink is. A standard drink, or the amount of alcohol your liver can metabolize in 1 hour, is 0.6 ounces of pure ethyl alcohol. This number may not mean much now, but it'll make more sense soon enough. If we take the 0.6 from the last slide and turn it into a percent, we get 60%. If you take that 60% and divide it by the alcohol percentage by volume, or ABV, of your drink of choice, it'll give you how much one standard drink is for whatever you're choosing to drink. The ABV can be found on any bottle, can, or menu. So let's practice. Beer ranges from 2% to 15%. A standard domestic beer, though, is usually 5%. So if we divide 60 by 5, we get 12 ounces for one standard drink of 5% beer. Note that if this beer was stronger, with an ABV of, let's say, 10%, a standard drink would be 6 ounces, not 12. To show you what this looks like in a standard 16-ounce red Solo cup, 12 ounces would only be filling the cup 3/4 of the way, not up to that very top line. For another example, wine ranges from 7% to 20%, with a standard table wine being 12% alcohol by volume. So if we divide 60 by 12, we get 5 ounces for one standard drink of 12% wine. And for our last example, we have liquor. Liquor is slightly more complicated because the ABV is represented in proof. To convert from proof to ABV, just divide by 2. So if we have 80 proof vodka, we divide by 2 to get 40% ABV. Then we take the 60%, divide it by 40%, and get 1.5 ounces for one standard shot of 80 proof liquor. To show you what this looks like, the standard small Dixie cup is about 3 ounces. So 1.5 ounces would be filling the cup halfway up. So if you choose to drink, here are some low-risk guidelines we recommend you follow to stay safe. Stick to 0 drinks if you're underage, sick, driving, taking medication, pregnant, in recovery, or if you haven't eaten. It's important to eat before you drink alcohol because the food in your stomach helps regulate the flow of alcohol into your bloodstream. Limit your consumption to no more than 1 standard drink per hour. As I mentioned earlier, that's the limit that our liver can metabolize per hour. Limit your drinking to no more than 2 times per week. This is because studies among college students have shown that students who exceed this limit tend to have negative effects on their social and academic lives. And finally, limit your consumption to no more than 3 to 4 drinks per outing or event. If your event is longer than 3 to 4 hours, stick to the 1 drink per hour guideline. Important high-risk behaviors to cover are sex and driving under the influence. If you're under the influence, the likelihood to using protection is lower, meaning you are at a higher risk of sexually transmitted infections and unplanned pregnancies. Furthermore, in the state of California, consent to sexual activity cannot be given if anyone engaging in the activity is under the influence of alcohol or any other judgment-impairing substance. When it comes to driving under the influence, there's a zero-tolerance law if you're under 21. That means if any alcohol is found in your system when you're driving, you can get a DUI. If you're 21 or over, your blood alcohol content must be less than 0.08. Keep in mind, however, that if your blood alcohol content is under 0.08 and you fail a field sobriety test, you can still get a DUI. It's important to note that DUI means driving under the influence of any judgment impairing substance. That means you can still get a DUI for driving under the influence of cannabis or a prescription drug that states you shouldn't drive while taking it. Another important topic to cover is alcohol poisoning and how to be aware of it. The signs are as simple as ABC. A means, is the person awake or alert? If you call their name and gently shake them and they don't respond, then they aren't awake or alert. B means, is the person breathing normally and is their heart beating normally? Or are they too fast or are they too slow? And C means, is the person's skin cold or clammy? This could be a sign of poor circulation. If you notice any of these symptoms in someone who has been drinking alcohol, please call 911 immediately because it is a medical emergency. Many students worry about calling 911 in these situations because they don't want to get in trouble because there might be underage drinking at the event that they're at. However, in California, we have a 911 Good Samaritan law, which states that you will be protected from prosecution, within reason, of course, if you call 911 due to an alcohol or drug-related emergency. So please, if you ever happen to be in such a situation, call 911 immediately and help save a life. So if someone is experiencing alcohol poisoning, you want to lay them down in the following position after you call 911.
So we use the Bacchus maneuver to ensure that a person does not choke on their own vomit. First, raise the person's arms closest to you above their head. Gently raise their knee up and walk to the other side and roll them towards you using their shoulder. As you roll them, be sure to guard their head. Tuck their nearest hand under the cheek and drop the top knee forward to stabilize. Gently tilt their head up so they don't choke on their vomit. And stay with the person and monitor closely. And as you're doing all of this, be sure to communicate with the person as you move them and let them know what you are doing at all times in case they can still hear you.
Some points to remember are to let the person know who you are and what you're doing to them at all times. This helps them stay calm just in case they can hear what's happening. Stay with the person and check on them frequently while you wait for help. And finally, directly delegate tasks and responsibilities to the people around you. Meaning, instead of yelling, somebody call 911, point to someone and say, you in the red shirt, please call 911. All right, so now we're going to cover cannabis use at UCI. According to our surveys, 16% of UCI students have used cannabis in some form in the past 30 days. But besides this fact, it is important to talk about the legality of cannabis at UCI. Though cannabis is legalized in California, it's still illegal under federal law. Since UCI receives funding from the federal government, the university has to follow federal law. So cannabis possession or use in any form or for any reason is prohibited on all UCI property. This includes buildings, parking lots, and campus housing. Using cannabis on UCI property can lead to really negative consequences, like the loss of financial aid or expulsion. But keep in mind that UCI is also a smoke-free, tobacco-free, and vape-free campus. So please don't use these products while you are on UCI's campus. So that's it for my presentation. Thank you all for listening. I really hope you learned, and welcome to UCI.